Hello everyone. Today we are going to learn about current issues and trends in care and psychiatric nursing. What are the current issues in this present situation and trends in psychiatric nursing? We are going to discuss one by one. So a psychiatric nurse faces various challenges because of changes in patient care approach. Daily in day-to-day life, in routine life, patients' care approaches are changing according to the need of patient, according to the technology. So some of these changes that affect her role, and this changes how it affects role of psychiatric nurse that we are going to learn. First one is demographic change. In that type of family, increased number of nuclear families. Before there were a joint family, number of joint family were there. But nowadays people are staying with a nuclear family, right? So increasing the number of elderly group. Day by day elderly people are increasing in numbers. So these are the demographic changes which affect the psychiatric nurses, and they give challenges in patient care approach. Next one is social change. The need for maintain intergroup and intragroup loyalties and peer pressure. Third one is economic changes, industrialization, urbanization, raised standard of living. This all are affected with the care which a nurse gives to an individual. Then technological change, mass media, electronic system, information technology. Before there were only classroom teaching, but nowadays see we all know we learn through technology. We take a class, we take online class, you have mobile. So on daily basis technology is changing, information technology is changing. Before the information provided only on the direct basis, but now through virtual media we can connect with each other. First one, mental health care changes, increased awareness in the public regarding mental health, need to maintain mental stability, increased mental health problems. Yes, we all know nowadays mental health problems are increasing, and we need to maintain our mental stability. If I talk about today's scenario, we all are suffering, not we all, but yeah, whole world is suffering somewhere somehow with COVID-19, coronavirus, right? So in that we need to maintain mental stability. It's very difficult for a nurse to reach each and every person. So yes, increased awareness in the public regarding mental health. If public is aware about mental health and how they can stabilize their mind in this stressful situation, so that will be a big help for a psychiatric personnel. So this is about mental health care changes. Next one is educational program for the psychiatric nurse. What are the programs are there for psychiatric nurse? So diploma in psychiatric nursing, the first program was offered in 1956 at NIMHANS, Bangalore. MSc in psychiatry nursing, the first program was offered in 1976 at Rajkumari Amritsar College of Nursing in New Delhi. MPhil in psychiatric nursing in 1990, MG University, Kottayam. Doctorate in psychiatric nursing offered at Mahamanipal, RAK, Delhi, NIMHANS, Bangalore. Short-term training for both the degrees and diplomas holder in nursing. So this was the education program for psychiatric nurse. Seventh one is standard of mental health nursing, quality of nursing care and accountability. development of code of ethics. So this is very important for a psychiatric nurse as she takes up independent role in psychotherapy, behavioral therapy, individual therapy, group therapy, maintains patient's confidentiality, protects his right, and acts as a patient advocate. Legal aspects in psychiatric nursing. The practice of psychiatric nursing is influenced by law, particularly in its concern for the rights of patients and quality of care they receive. The client's right to refuse a particular treatment, intentional tort, informed consent, confidentiality, and record keeping are few legal issues in which the nurse has to participate and gain quality knowledge. Promotion of research in mental health nursing. We need to research many things in mental health nursing. As a psychiatric nurse, we need to give importance to research in psychiatric nursing, and whatever research you are doing, it is more important to publish that. So in future, those who are conducting the research, they can have evidence-based nursing, which means we are providing them research and you can go further in depth. Cost-effective nursing care. Studies need to be conducted to find out the viability in terms of cost involved in training a nurse and the quality of output in terms of nursing care rendered by her. Focus of care. So care of elderly, children, women, youth, mentally retarded, and chronically ill. These patients or these individuals are our priority person. Now, let's see new trends in role of psychiatric nurse. What we discussed about is what are the current issues we were suffering that we discussed. Now we are discussing the new trends in role of psychiatric nurse. So first one is primary mental health nursing. Let's see. So psychiatric nurses are moving into the domain of primary care and working with other nurses and physicians to diagnose and treat psychiatric illness in patients with somatic complaints, right? Cardiovascular, gynecological, respiratory, and gastrointestinal and family practice settings are appropriate for assessing patients for anxiety, depression, and substance abuse disorder. Next one is collaborative psychiatric nursing. In collaborative psychiatric nursing, patients like who have difficulty in being stabilized on their medications or who have comorbid medical illness are seen in psychiatric nursing clinic where a nurse and physicians collaborate to provide high quality patient care. Next one is registered psychiatric nurse. So what a registered psychiatric nurse is do is she provides psychiatric mental health nursing care to individuals, families and groups to enable them to function at an optimal level of psychological wellness through more effective adaptive behaviors and increased resilience to stress. She must be able to provide safe, basic physical care and have a wide understanding of psychological and developmental problems and their treatment, and have a highly developed level of communication skills. And what else she does? She works with her children, she works with an adolescents, adults and elderly with dysfunctional behavior pattern and developmental handicaps. a registered psychiatric nurse works as an independent entity. She works in a various kind of inpatient facilities and community settings. Next one, clinical nurse specialist. So the clinical nurse specialist provides consultative service to nursing personnel, and she attends clinical teaching programs, demonstrates therapies, conducts in-service education programs, initiates and participates in curriculum revisions, changes, and in nursing research. Next one is case management. Like using case management, a psychiatric mental health nurse is responsible for assessing the need, identify services and monitoring and evaluating client status. A case manager coordinates care through collaboration with all involved health personnel, ensuring accessibility and availability of care. It means in case management, a case manager, she has to coordinate with or collaborative approach. She needs to take to give care. She needs to collaborate with all involved health personnel to ensure accessibility and availability of care. Next one is nurse psychotherapist. So what a nurse psychotherapist do? She can take up psychotherapy roles as an individual therapy, group therapy, and a counseling. Psychiatric nurse educator. So the main function of psychiatric nurse educator is planning and changing the curriculum according to the need of the society and learner. The Indian Nursing Council has included psychiatric nursing as a compulsory subject for qualifying the Bachelor in Nursing program. Right? So the number of nurses in the field of teaching psychiatric nursing needs to be enhanced, and this is a big challenge for nursing curriculum planner. Next one is psychosocial rehabilitation nursing. So it is mainly concerned with helping people with chronic mental illness to lead more independent and satisfactory lives in the community. Next one is child psychiatric nursing. So what is child psychiatric nursing? In child psychiatric nursing, the nurse identifies emotional and behavioral problems of children and provides comprehensive care. Next one is gerontological and geriatric nursing. So gerontological nursing provides emotional support to those people who have retired from services, who have no financial sources, and help them in understanding the situation and developing new coping mechanisms. And in geriatric nursing, it's expanding the psychiatric nursing practice to aged people who have been affected by emotional and behavioral disorder such as dementia, chronic schizophrenia, and delirium. Next one is de-addiction nursing. So what is de-addiction nursing? Is a psychiatric nurse in this unit identifies psychosocial problems and maintaining factors in addicts. She also provides various therapies to the addicts and their family members. Those who are addicted to drugs, for them, a psychiatric nurse provides a therapy. Neuropsychiatric nursing. So in neuropsychiatric nursing, this practice is extended to patients who are suffering from neuropsychiatric disorder such as dementia, epilepsy, brain tumor, head injury, with behavioral problem, or with HIV infection, with behavioral problem. So for this, we use neuropsychiatric nursing. Next one is community mental health nursing. So this is familiar, quite familiar. Community mental health nursing is application of knowledge of psychiatric nurse in preventing mental illness, promoting and maintaining mental health of the people in the community area. And this includes early diagnosis, appropriate referrals, care and rehabilitation of mentally ill people. Next one is advanced practice role. So in advanced practice role, it's a nursing leadership in forensic health unit, like crisis intervention unit, a risk assessment and management in community setting. So these are the roles in advanced practice. So today we have discussed about current issues and what are the new trends in psychiatric nursing. So let's summarize the topic. Today we have discussed about demographic change, social change, economic change, technological change, mental health care change. Then we have seen educational programs for the psychiatric nurse. Then we have seen standard of mental health nursing, development of code of ethics, legal aspects in psychiatric nursing, promotion of research in mental health nursing. Then cost-effective nursing care and focus of care. Then we have seen new trends. What are the new trends in role of psychiatric nurse? So first one was primary mental health nursing, collaborative psychiatric nursing practice, registered psychiatric nurse, clinical nurse specialist, case management, nurse psychotherapist, psychiatric nurse educator, psychosocial rehabilitation nursing, child psychiatric nursing, gerontological and geriatric nursing. Then we have seen de-addiction nursing, neuropsychiatric nursing, community mental health nursing, and at last we have seen advanced practice role. So this is all about it. Thank you.